Hey everyone, and welcome. Today we're diving into a topic that is just so incredibly important for anyone navigating the world of ALS, caregiver training. And look, this is so much more than just a nice to have. It's an absolutely essential lifeline for the people providing that day in, day out care. So let's get into why. And I really want to start right here with this quote because it gets to the very heart of it. When a caregiver calls these courses lifesavers, that tells you everything, right? We're not just talking about some clinical checklist. We're talking about a genuine tool that helps people manage the real, raw, daily challenges of caring for someone they love. So to really get why this training is so critical, we first have to take a moment and just acknowledge the profound weight that comes with being an ALS caregiver. You know, what makes caring for someone with ALS so uniquely difficult is that it's not a static job. It's a constantly moving target. Because the disease is progressive, the needs of the person you're caring for are always changing, always intensifying. A routine that worked perfectly last month might be totally useless today. And that requires this incredible level of constant adaptation. And if you want a number that really puts that strain into perspective, here it is, 60%. That is the annual turnover rate for paid professional ALS caregivers. I mean, that number is just staggering. It gives you a real glimpse into the immense pressure of this role. And if it's that hard on the pros, you can only imagine what it's like for family members. So that brings us to the big question, right? What is it specifically that makes this so incredibly challenging? Well, let's break down some of the biggest hurdles that caregivers face. It's never just one thing. It's more like a perfect storm of challenges. Of course, you've got the huge time commitment. But then you layer on these deep emotional barriers. You're dealing with grief, you're dealing with frustration. On top of that, it can be really hard to find the right resources. And you're always having to adapt to the very specific personal needs of the patient. But here's where the narrative starts to shift. We've talked about the weight of the problem, so now let's turn to the solution. Because this is where training stops being just an idea and becomes that genuine lifeline we were talking about. So, what do we actually mean by training? Well, you can think of it as giving someone two different toolkits. First, you have the practical toolkit. This is the hands-on stuff, the knowledge you need to do tasks safely. But just as important is the emotional toolkit. These are the tools to help manage the immense mental and emotional impact on everyone involved. And the payoff here is huge. Good training obviously improves the patient's quality of care and their comfort. But, and this is so important, it also dramatically reduces the caregiver's own stress and burden. It helps prevent that burnout we talked about, which means they can actually sustain that high level of care for the long run. It is a total win-win. Now, something that's really important to understand is that not all caregivers are starting from the same place. The goal is always the same, to provide amazing care, but the journey for a family member versus a paid professional, well, they look pretty different. Let's break that down. Think about it. A family caregiver starts with this incredibly deep emotional bond, but they often have to learn all the practical, hands-on skills from zero. Their biggest battle is often managing their own grief and avoiding burnout. A paid caregiver, though, they start with the professional skills already in their back pocket. Their primary need is to learn the patient's very specific routines and preferences, and their big challenge is building trust and fitting into the family's world. That's why a one-size-fits-all training plan just doesn't cut it. So let's dig into that first path. What does that toolkit for family caregivers actually look like? How do they build both the skills and the resilience they're going to need? The whole point here is to make this stuff feel doable, not overwhelming. We're not talking about a formal classroom. You can start with online videos and handbooks. There are so many great ones out there. Practice the key tasks, like wheelchair transfers. And this is so critical. Involve the person you're caring for. Learn their preferences. Even role-playing a few scenarios can do wonders for your confidence when the real situation comes up. And then there's the emotional toolkit, which is every bit as vital. This means learning skills like active listening, finding those little moments for humor to break the tension, and even doing empathy exercises. Seriously, research shows this stuff makes a massive difference in the well-being of both the caregiver and the patient. And celebrating the small daily wins, that can be an incredibly powerful way to keep your head above water. And if you need a reminder of why that self-care is so important, just look at this number. Almost a third of caregivers say they struggle just to get enough rest. If you don't build strategies to take care of yourself right into your routine from the very beginning, burnout isn't just a risk, it's pretty much a guarantee. Okay, so let's flip the script and talk about the toolkit for paid caregivers. They're coming in with professional skills, so their training needs to be all about adapting that expertise to a very specific, very personal home environment. For the pros, the priorities just look a little different. Something as simple as a patient-specific orientation guide can be a total game changer. Training should really focus on mastering that individual's specific communication devices, on empathy and listening to build that crucial trust, and on adapting their skills to any unique equipment in the house. And because ALS is always changing, a commitment to ongoing learning is absolutely non-negotiable. All right, so we get it. Training is essential. We know what it should cover. The final piece of the puzzle, the million-dollar question, is how do you actually make it happen with all the real-world barriers that get in the way? What's so great about this is that the solutions are often really simple and accessible. Time is the biggest hurdle? Okay, use short, focused online training modules you can do on your own schedule. Hitting emotional walls? Then you build coping strategies right into the training itself. Don't have a big budget for resources? Tap into the huge number of free online guides and caregiver forums. And for adapting to patient-specific needs, the best resource is always right there. Involve the patient in everything. And this brings us full circle, back to the voice of a caregiver. The word here that just jumps out is sustainable. That's what this is all about. Training isn't just about surviving the day. It's about building the emotional and practical foundation to make this incredible journey of caregiving sustainable for the long haul. At the end of the day, just recognizing that training is a need and then fighting to make it accessible is one of the most powerful things we can do. It really leaves us all with a big question to think about. How can we, as a community, do a better job of supporting these incredible heroes behind the care?